Good afternoon. My name is Mary Brown, and I'm a dental hygienist here at Unity Healthcare Brentwood facility. Glad you're here for our mini presentation. We're going to do our presentation on upgrades, aids for effective oral hygiene. Well, when I think about upgrades, I think about cell phones. And we update and upgrade our cell phones so that we can communicate more effectively, and it makes it easier. So, we're going to talk about the 8 upgrades on our dental tools that we use to maintain good oral hygiene. Okay, so just a little bit of history. We're going to talk about plaque versus calculus. Okay, now see, plaque is the soft deposits that forms on your teeth, basically a few minutes after you put food in your mouth. And if you don't remove that properly, it starts to calcify or harden, and it destroys the teeth and the bone that actually holds your teeth in your mouth. That's the foundation. So if you lose a foundation in the house falls in. Okay? So we're going to talk about the tools that you actually need to maintain good oral hygiene. Okay? We're going to start with toothbrushing. We can talk about the traditional types of toothbrushes, and even they are upgraded. So they're not as hard as they used to be. You can get them ultra soft, medium, firm, because you don't want to brush too hard because it causes your teeth to be sensitive to hot and cold. Okay? So we can go from our traditional toothbrushes to a more updated toothbrush. They've come a long ways. Dental technology is awesome. So you can, let's say, expensive, spin brush, battery operated, awesome toothbrush. You can use it for a whitener. Works very well, very well. Or our more conventional, more expensive toothbrushes, Philips Sonicare, works very well on the teeth and the gums. Or the combination, Sonicare, easy to use, combination of toothbrush and water flosser. More expensive, very effective. Okay? Water flosser. Technology has changed. And I remember when I was in dental school and we had one of the traditional smaller, but it had its little weaknesses, and they have really perfected it. So you should brush your teeth at least twice a day to remove the buildup. The plaque that we showed you in the previous slide, that's what you really want to remove, okay? So you can maintain healthy teeth and gums. So with the water flosser and toothbrush, with our water flosser, we want you to use it once a day or as needed, because food packs between the teeth. When you start to lose the bone in between the teeth, food packs in between there. So sometimes floss can't get down in there because you have what we call pockets where you've lost some bone. The water flosser is an excellent device to remove that buildup or the debris that's under the gum tissue. Okay? Or you can use your traditional dental floss, and you wrap it around your fingers and seesaw it in between your teeth. Don't pop it in, don't pop it out, because that's soft tissue on top of bone. So you don't want to pop it in, seesaw it in, curve it around the teeth, C-shape around the teeth. And if you find that the floss is stuck, release the end and pull it through. Okay? Now, before we end, let's talk about annual dental exams. You should have your teeth examined and x-rayed by your dentist annually, okay? Not only do they do your exam, your x-rays, they do oral cancer screenings, especially for those of you who smoke. Now, does anybody in here smoke?
No.
Okay, that's good. We're proud of you, okay? And then you want to have your cleanings every 6 months, and sometimes every 3 months, because if you have a sufficient amount of bone loss, you really may have to have your teeth cleaned every 3 months, okay? So when you come in, your dentist will refer you either to a periodontist, a specialist that specializes in gum tissue, or you may be able to receive treatment there in the dental office. Okay? So we have these devices, and these are definitely upgrades that will definitely help you maintain good oral hygiene, and they're definitely effective. Okay? Now, do we have any questions? We really thank you for coming. We appreciate your time because I know it's been really busy. It's been kind of a hectic week, and you've taken time out of your schedules to come here for this mini presentation. Any questions?
No.
Thank you. Before we close, I really would like to thank our dental director, Dr. Clarence Hamlin, excellent director. I would like to thank Dr. Coley, who spearheaded this and really assisted us and helped us to put this together. It's just been awesome. I'd like to thank Dr. Elliott, who is our medical director, and Ms. Sylvia, who is our health center director. So with that, we're just going to end on this note, and we'd like to thank you for coming. Have a good day.